particularly in the two northernmost parts of the country, has been zero in terms of reporting levels. Zero. You know what that means? They post doctors there and they don't show up. But there's a general conversation that we need to have, and this conversation must not focus on, the doctors don't want to go there. Why don't they want to go there? They must be made to go there. They must do that. No. It goes far beyond all of that. And we'll seek to try and break it all down for you this morning. We'll stay off by laying the premises on what the minister had to share on the concern. Then I'll walk you through what the numbers are. And if you're following us on YouTube, on Facebook, where we're streaming, you have the privilege of being able to see the graphic content with which I'm going to be displaying. Here, graphic doesn't mean something which is unsavory or cannot be seen. It's just an infographic that's been worked on and we're sharing on our Facebook and YouTube as well, which I'll be reading from, and so you can follow as well. But here's the Health Minister, Kwabena Kando, for starters, on the problem. And then we can begin a conversation as to how we can stem or turn around this particular challenge on our hands.
Posting of new medical officers across the country. Assad, Friday. That is last Friday. It's not encouraging. We will give them additional 1 week to appeal to them to report to their various facilities where they have been posted. After which we will do what we call validation. Whilst we are also engaging the stakeholders in their respective districts, regional ministers, members of parliament, DCs, chiefs, to facilitate their stay in their district to be able to give up their best. We have started that myself. Engaging them. And so government will also look at how we can incentivize them to give up their best in these districts where they have been posted. We have nearly 50% of all medical doctors we have in this country in Greater Accra alone. Nearly 50%. It's not scary. So at this point, government has taken a decision. Now look, let's
Health Minister Kwabena Kando there, laying out what the problem is. But let me walk you through what that graphic says, right? And so both in the Upper East and Upper West regions, we know that doctors are not showing up. Show the first one. I'll return to this. But total doctors posted for this year, 463. 305 are yet to report. 305 are yet to report. If I work the math properly, it's roughly only 149 thereabout, or 148 who have decided to turn up at the respective facilities or their respective regions which they've been posted to. And we'll go into the breakdown right now. And this is why it's very concerning, right? So Northeast, Upper East, Upper West, no doctors have turned up. In the Northeast region, 19 doctors were posted to the region, 0. They are yet to report. In the Upper East region, 0 out of 35. In the Upper West region, 0 out of 32. Then in the OT region, there's only 1 who's made themselves available after they were posted out of the 21 posted to the OT region. In the Western North region, 2 out of 31. In the Northern region, 7 out of 32. In the Bono East region, 9 out of 27. In the Savannah region, 7 out of 19. We come to Western region, 14 out of 37 have showed up. In the Bono region, 11 out of 29. Ahafo, 8 out of 21. Volta, 15 out of 37. In the Central region, 20 out of 34. In the Eastern region, 23 out of 36. Ashanti region, 25 out of 33. And then Greater Accra region, 16 out of 20. So Greater Accra, Ashanti, Eastern, Central are the only regions where more than half of the individuals posted have actually turned up. And that, my dear friends and listeners, most certainly is a cause for concern, because already we do not have enough doctors, and yet they are not turning up. There's an entire conversation that can be had about why they are not turning up, and some of the reasons which have been suggested: weak internet or telecommunication services in some of these areas, limited access to clean drinking water, limited education and childcare options, less social and networking, poor road network. Just a handful of the reasons and justifications for which they are not turning up. That's why I said today, when we are getting into this conversation, I want us to approach it in all fairness to all parties who are expected to be a part of the conversation. The doctors in one part, the government and the persons who are posting these individuals to the respective regions as well. What is the expectation? Why are they not turning up? Are these reasons which I have walked you through justifiable enough
across the country?
To have in some of the regions zero,
failed to report
zero,
to the
3 out of the regions, zero.
Reported does not mean that the person
not showing up at all.
A troubling trend in Ghana's healthcare system is once again making
headlines. Let's listen to the General Secretary of the Ghana Medical Association.
A troubling trend in Ghana's healthcare system is once again.
And then we'll return for a bit more on this.
A troubling trend in Ghana's healthcare system is once again making headlines as a nationwide posting exercise exposes deepening cracks in the sector. 7 out of every 10 medical officers recently deployed across the country, according to data from the Ghana Health Service, have failed to report to their assigned post. Out of 463 newly posted doctors, 305 have not shown up. In the northern, Upper East and Upper West regions, not a single medical officer has reported for duty. This is unfolding at a time when Ghana is already struggling with a long-standing imbalance in the distribution of health professionals. Current data shows that over 80% of the nation's doctors remain concentrated in just 2 regions, the Ashanti and Greater Accra regions. The health minister has since given the newly posted doctors 1 week to report to work.
We will give them 1 more week to report to their various health facilities. We have nearly 50% of all medical doctors we have in this country in Greater Accra alone. It's not scary.
Health experts warn that the disparities are widening, raising urgent concerns about service delivery, equitable access to health care, and the country's overall health system stability. What is keeping the doctors away? General Secretary of the Ghana Medical Association, Dr. Richard Solomon, maintains that the narrative suggesting that doctors are refusing posting is inaccurate.
The fact that the person has not reported does not mean that the person has refused posting. So I think that needs to be corrected. This posting just happened just barely, I think 2 weeks or so ago. Some have committed themselves to certain engagements to feed, to be able to live, and they have to disengage. It's also important to note that some have also reported and have been told there's no accommodation.
He wants the Ministry of Health and relevant authorities to address these and the lining concerns if the situation is to improve.
So, for example, if you were posted to, for example, Boku, where there are serious security concerns, you will need some assurances of how safe you are to be able to provide the care. If you have been also told, for example, that there's no accommodation available, you will need some assurances of where you're going to stay so that you can respond to emergencies at the middle of the night, etc. And so these discussions must happen, and that is what we are feeling, that beyond just issuing the fiat, it is important that conversations like this happen, and those that have certain genuine concerns, we address those issues so that they can go. So it is not a matter of they've refused, they've not refused, and they don't want to go, and what is that?
Concerns have been raised about.
Dr. Richard Solomon, that report by my colleague Noble Crosby, and Dr. Thomas Anaba He is MP for Garu and a member of Parliament's Committee on Health. He also set up a civil society group, which it was a very regular. I spoke to him quite a number of times here on 3FM and on TV3, and I've had the privilege of speaking to him now that he's been member of Parliament as well in his office. Doc, I appreciate you speaking to us this morning, and thank you very much for joining us here on the 3FM Sunrise.
Thank you for having me, and good morning to your cherished listeners and viewers.
I trust that all is well with you. It's been a while since we spoke. I haven't been a very good friend, if I can call it that.
That's okay. We are all busy.
Doc, I want us to take it from the explanations. I don't want to call them justification, but in seeking to put this into proper context, Dr. Richard Solomon, who is a General Secretary of the Ghana Medical Association, makes very important points. You've posted doctors to regions. Accommodation is not secured yet. They don't know about, in some of the areas where there are security concerns, you're not quite sure what should happen in that regard. Is there a problem? Not with the fact that the doctors are not going, but I want us to reverse a bit with the means through which the posting is done. Because from what he is telling us, it does appear that, okay, the system does its work and persons are just asked to go to Upper East, go to Upper West, go here, go there, go that. And that's where it ends. You're supposed to find your way there and find your own accommodation, find ways and means through which you can stay and work to the benefit of the people there. That appears to be a problem in itself.
Yeah, thank you. I think this issue of doctors not accepting posting to some deprived regions or deprived areas in the country has lived with us for a very long time. A lot of reasons has been given to it, and we know that those reasons are still unchanged virtually. And as we all know, everybody would like to live at the place of his comfort. So at least posting of anybody at all to any place that the person doesn't like, be it a doctor, be it an engineer, be it a nurse, be it a custom officer, a police. Sometimes they even lobby to the police, even the security forces lobby to change places. This is just unfortunate that we are not able as a country to put in the needed conditions that we need to put in place to at least encourage some critical group of professionals to accept posting to any part of this country. That is what we all need to look at. I think several governments have proposed rural incentive, and the package is there. Implementing has become a problem, and I would urge that we look at those conditions being put forward by the associations, as well as the promises that we have all made to ensure that critical professionals are given some special treatment. It is done in other countries. I can tell you countries like Malaysia, countries like Australia, countries like Canada, even Israel have put in certain conditions to give preferential treatment to doctors who accept posting to very difficult places. And even foreign doctors who want to go to those countries, they have special immigration policies for them. This is what we should be looking at as a country, to also have some special policy for those who will be going to deprived areas. If that is failing, then we may have to look at a proportion of our medical training institute schools should be given admissions per quota basis to districts that are deprived. And whoever goes to sign up with a district to take their chance to go to read medicine should go back there and work for at least 5 to 6, 7 years before he can decide to change a place. This is what some of us think that can help reduce the refusal of going to communities that we consider deprived. And besides that, economic development, social development should spread evenly across. Because if I'm a doctor in Accra, there's a possibility that I can get to do a locum in addition to my normal hospital that I'm working. It's possible that if I'm sick, I have more doctors around me to attend to me myself when I'm sick. It is possible that I can get a good school of fame for my children to go to school. It is possible that when I buy my car, I don't drive in potholes, horrible places to get to my destination. All these things are factors that we must look as a country to provide for such critical groups of people. The current refusal, as you have said, they have listed the reasons for refusal, is something that I think the ministry is working hard to get the hospitals, see what they can do to provide them accommodations, like they have said. I was in Tamale. When I was transferred from Accra to Tamale, I got there. I had to be in a temporary place for 3 months before they got me a permanent place. This also calls for some little sacrifice. I would always say it. To do medicine, to work in Ghana, to do your national service, it calls for some little sacrifice. I'm not totally condemning the doctors, but I'm just appealing to them that whatever they get for them for the meantime, even it's a guest house for them to stay, for them to get them a permanent place to stay, I think the hospital should quickly arrange sectors and at least let them come and stay there while they look for a permanent place for them. We must look for means to satisfy the need of at least accommodation for them to be able to go. We can't have everything, all the conditions met within 1 year.
Well, absolutely. But
we
Doc,
must work gradually to fulfill such conditions.
Doc, not to cut you, but that's one thing that's come up for conversation. That shouldn't that be central in the conversation? Because the minister in issuing a fiat says that, look, by 1 week, I'm giving you 1 week to report to your post. 1 week when I don't have a place to sleep, 1 week where the conditions are not conducive. I don't want to go to a place, and I'm just basing on the reasoning of the health professionals here. I don't want to go to a place where I cannot get good schools for my kids. So why should I be going? And you're issuing an administrative fiat to me that I should report in 1 week. I will not want to do that. I mean, they are saying that the conversation can be different and should be different as led by the minister.
No. The issue is that for now, those they are posted are young doctors who have just graduated. I don't think they have already have families. They have to move with families. No. And I don't think that the minister is not aware if they go to the place, the hospitals will find something for them. Normally, when you are posted to a new place like this, generally, the hospitals would rent a place for you because they are all going to be district hospitals or regional hospitals. They will rent a place for you temporarily if the old ones haven't vacated, for you to stay there while they look for a permanent place for you. I know for sure that is done. So it is not that absolutely there's no place for them.
Absolutely.
Perhaps the permanent place that they may not get, but at least for the first 2, 3, 4 months, the hospitals would find a place for you, be it a guest house, be it a hotel room, whatever, for you to stay there temporarily. Then they now look for a permanent place. Those who have passed the stage of service and have passed the stage of being general doctors, they find their places and they get a place for you. So I don't think the minister perhaps is speaking out of vacuum. Perhaps instructions too might have been given, has always been given, for the hospital to be responsible in finding accommodation for them. Even I know for a fact that sometimes they come to tell the ministry that, oh, we have a place for these doctors, post them to us, we'll get place for them because they are allowed to rent for doctors. Perhaps the conversation has not gone deep. Let's not think that the ultimatum is perhaps to force them to go to a place that the conditions are not good. But who is going to work in those places to develop the place for who to come and stay? We must all sacrifice. Look, I was a specialist who came from abroad, highly needed in Rich Hospital Cardio Center as an anesthesiologist. And when they asked me to go to Tamale, I packed bag and baggage with my wife, vomiting in the car, pregnant, and went to Tamale.
Right.
We have to sacrifice a little to at least to develop this country. Once we call on government and call on administrators of hospitals to ensure that they also provide the doctors who are scarce to come by the needed conditions to enable them to accept posting to go there. For me, I wouldn't say the hospitals would not find them place to stay. They will find place, but it might not be the very suitable one they need for the beginning. And let's please appeal to the young doctors. Please go and save our relatives. Tomorrow, within 3 months, 4 months, they can find a permanent place for you and a comfortable place for you. Once you are there and the conditions, the hospital themselves knows that, look, this place they are staying is not good to stay for too long. They will definitely look for a rented place and put you, because that is what they are doing all the time. So our appeal to the young doctors, for the sake of national service, for the sake of our patients who are suffering with one single doctor at the hospital or no doctor at all, do the sacrifice and go. And I also call on the public, opinion leaders in our communities with our doctors, to develop a scheme of the public trying to at least appreciate the work of doctors who accept posting to their communities. Because I know of some communities where the chiefs at the end of a month or every quarter would call the doctors, give them some donation, encourage them to stay, even gather funds from well-meaning people from the community to support the doctors staying there. These type of things should be done so that when they come, they believe that, oh, the community appreciates it. They are supporting us. If somebody who has a nice guest house can just decide that, look, I'm giving a room out for one doctor to come and stay there until the government gets in a permanent place, that alone will motivate them to go. We shouldn't leave everything on government. We have traditional rulers, opinion leaders in the communities who are well respected. They should look at this as a concern for them to provide such services free of charge. What is wrong with somebody saying, look, my house, I have 2 bedrooms free. Let the doctor come and stay there till you get in a place. Let me encourage the public to also do this. It will help a lot to get these care doctors to accept posting to these difficult places. I can tell you, Ghana, we have 1/3 of the number of doctors we want. We need 34,000 doctors in Ghana per our population, but we have only 12,000. So it's difficult to get them to go to the rural areas, because even the hospitals in the cities can absorb most of them, especially the private hospitals, can absorb them. We need to do something to create some, at least to minimize the inequality that exists in this distribution of doctors. That is what the minister is looking at and giving them that ultimatum. They should go. The hospitals, for sure, would find them places to stay temporarily while they look for permanent place for them.
Doc, I appreciate you joining us this morning for this conversation.
It's a pleasure, and thank you very much for having me.
Right, and so that's Dr. Thomas Anaba. He's the executive director. He was the executive director of the Africa Center for Health Policy Research and Analysis. Doc, is that position still there, or I can come for it now? Since
you can come for it.
He's a member of Parliament for Garu as well, and a member of the Health Committee as well. Doc, I appreciate you speaking to us this morning, and hopefully, when we have a conversation again about posting, the situation will be a lot better.
I pray the situation gets better very quickly so we don't have people rejecting posting. Thank you very much.
That's Dr. Thomas Anaba speaking to us this morning here on the 3FM Sunrise.
92.7 3FM. 92.7